Phyllis Miller from Forbes. Jillian, I think you'd be disappointed if I didn't ask where we're up to with the Parkes and Forbes Hospital. And that is my first question. My second is, you are aware through Centroc that we have done Beyond the Ranges. It is an initiative to try and attract workforce beyond the Ironstone Curtain. It had a lot of resources in it. It had Greater Western Area Health, there were university, TAFE, local government, health professionals that put that together, and I give you the invitation to give that to our local Western Health Council to have a look at. I'm sure you most probably would be aware of it, Dr. Williams. I think that there's some merit in that for doing a pilot somewhere in the state and seeing just what benefits we get. Now, that's a small investment by either the state or federal government to get that up and running and online. But the hospital.
Minister.
Thank you very much, Phyllis, and for also always warmly welcoming us to Forbes. I think I've visited Parkes and Forbes along with Troy more often than I've visited any other smaller country community. Great drive out there. Look, we've made a commitment, as you know, for the initial funding for Parkes and Forbes Hospital. Parkes to be a brand new hospital, Forbes to be redeveloped. There's one management across the two, and work should start on that in our first term, and we're looking for continuing funding beyond that to complete the project. It's the first time, look, I can remember Phyllis coming out there, oh gosh, in '95, I think, first of all, and then when the hospital was promised so many times to that community, and which is why I was absolutely adamant we were going to put Parkes and Forbes hospitals in the budget this first term, and that's where they are. So you can watch this space. We'll be making Parkes and Forbes redevelopments happen. In terms of your workforce ideas, yes, we will pass that on. There will be some very good ideas in that. You should know as well that Melinda Pavey is assisting with the development of a health workforce plan for 10-year New South Wales Health Workforce Plan. There are a lot of initiatives that will be looked at in that. One of the other things that we've done, and Robin was there when I spoke at the Rural Doctors Network, Rural Doctors Association Forum on doctors, on the pathways we have for rural practitioners. So there's a lot of work that is being done to try and understand how we can better attract doctors, particularly to country communities, but not only doctors, to allied health professionals, nurses and others. And one of the great things I learned when I was in Broken Hill yesterday at the clinical school there is how they really, this happens when you get isolated communities. They're inventive about how they work together, about how they share each other. They've got facilities out there which are sharing doctors, sharing allied health professionals, so they spend 2 days here and 2 days there. So there are innovative ideas that we need to work up and new patterns of people working together, doctors, nurses and others. And I think that it is, as Robin said, one of our greatest challenges, but I'm convinced the solution to it is going to be in country New South Wales.